Oh my god, this test's gonna be awful.
No.
So much to learn.
You have the study guide, right? Hi, Dr. Phil.
Hello, student nurses.
Dr. Phil, we're having a really hard time with this. Can you look at the study guide and explain to us distribution? We're just having a hard time understanding it.
Well, the definition of distribution is the movement of drugs from the blood to the site of action.
Wait, so what does that mean for us as nurses, and how would we explain that to other nursing students?
There are 3 factors influencing drug distribution. Melissa, please state one.
Well, blood flow to tissue, for example, in order for a drug to reach its intended site of action, this wound right here, the blood needs to be able to take it there, aka distribute it. Hey, Nicole, don't you know another one?
Yeah, sure, Melissa. The ability of the drug to exit the vascular system. So if you want to take a look at this picture in my textbook, drugs normally exit the vascular system through small pores right here in the capillary wall. But there are some things in the body that keeps this from happening. Dana, you know one, right?
Right, the blood-brain barrier. It prevents drugs from exiting the blood because the capillary pores in the central nervous system are so small that it forces the drugs to pass through capillary cells rather than between them. This is good because it prevents toxic drugs from entering the central nervous system, but it also makes it really difficult to treat diseases of the central nervous system because it's difficult to get drugs to their site of action.
Good point.
Kara, do you know another?
Yeah, I think that placental drug transfer might be a concern because if you have a pregnant woman who's taking drugs, those drugs can go through the placenta to actually reach the baby and possibly cause harm to the baby. Might cause low birth weight or lots of other malformations. I think there's another factor, protein binding. Does anyone know?
Oh yeah, exactly,
wait, what
protein
is that?
binding. Well, that's when the drugs bind to a protein, aka albumin. Because of the large size of the drug, and they're bound to a protein, they can't leave the bloodstream. It's kind of like when you guys are always together.
Oh, yeah.
You know how you're always together.
Yeah.
Well, imagine trying to get through that door bound together. So why don't you link arms and try and get that orange backpack?
Whoa.
It's difficult to do, isn't it?
Yeah.
Okay, because you're bound together, just like drugs and protein, it's, it makes it more difficult to leave the bloodstream, and it can't do
That
it.
makes so much more sense. Thanks, John.
Okay. You know what? There's one more factor I can think of. Melissa, do you know?
Yeah, the ability of the drug to enter the cell. Some drugs need to get into the cell to reach their particular site of action, and then all drugs need to get into the cell in order for them to get to the next 2 steps, metabolism and excretion.
Oh, got it.
Well done. It is important to understand how this will impact your future nursing care. Dana, can you summarize, please?
Well, yeah, the therapeutic objective is to provide maximum benefit with minimal harm. To provide maximum benefit, effective distribution is imperative. If the drug doesn't reach its site of action, it cannot be effective, and therefore it's not beneficial. In this case, if we're not providing the patient with beneficial drug therapy, we're not providing the best nursing care possible.
Oh, that makes so much sense.
Thanks, Dr. Phil.
Well done, student nurses.